But certainly the patient interaction is one of my favorite aspects about anesthesiology, because it's just, even though it's not something that we're doing for necessarily a very large percentage of the day, it's something that when we are engaged in patient interaction, it tends to just be deeply important for the patient. And so therefore is meaningful for me.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional healthcare careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. Dr. Feinstein is a current PGY5 Pediatric Anesthesiology Fellow at Columbia University Irving Medical Center in New York City. He also runs an educational YouTube channel that has amassed over 140,000 subscribers in just a few years. Dr. Feinstein started his healthcare journey in pre-med at the Harvard Extension School, after which he attended Case Western Reserve in Cleveland, Ohio for medical school. Upon graduation, he completed 4 years of anesthesiology residency training at the Mount Sinai Hospital in New York City. Outside of his professional career and through his YouTube presence, he has amassed a large medical community following who gravitate towards him for his wisdom related to medical student education and insight regarding the profession of anesthesiology. His most popular video, including How an Anesthesiologist Sets Up an Operating Room for Surgery, has over 1.4 million views alone. It was actually through this content that I came to better understand the practice of anesthesia, and the skills he taught me ultimately allowed me to obtain honors in my anesthesia clerkships. If you have an interest in this unique and competitive specialty, you'll absolutely love our interview today. Alrighty, Max, welcome to the show today.
Thank you very much for having me. It's an honor to be here.
Wonderful, wonderful. And you certainly have a very impressive professional profile. So can you tell us a little bit about yourself and what your life was like prior to going to medical school?
Yes, and thank you. So I did not initially have a career trajectory going into medicine at all. When I was growing up, it wasn't something that I gave any serious consideration to. But then when I was at the tail end of my philosophy undergraduate degree at the University of Southern California, I started thinking about a career in medicine and started exploring pre-med classes and what I could do in order to just understand whether it would be a career that made sense for me. So I also started volunteering in a hospital, doing really all of the typical things, really prerequisites that people do if they're applying to medical school. There was no magic aha moment, but just through a series of volunteer experiences, I was able to ascertain that it was a great career choice for me, and I'm very happy that I did it.
Wow, I think that's awesome. And I take it too that you also got your master's in philosophy. So how did the teachings and trainings from that particular background help with you finding and experiencing medicine as a whole?
Yeah, so where I did medical school at Case Western Reserve University, they offer a variety of master's degrees that you can take along with your degree in medicine. And so they had a master's degree in bioethics, and I was really interested in that just because it seemed like a great way to bridge what I was doing as an undergraduate with medicine and find where the common ground was. And I think, for a lot of physicians, there can be a question of, how much is ethics really a part of what you do on a day-to-day basis, particularly for certain specialties like anesthesiology. When I was interviewing for residency, I remember an interviewer asked me, he said, "Are there any ethical issues that come up in anesthesiology?" And the answer is absolutely. And so what I found when I was taking those classes is it gave me a really great foundation for thinking about ethical issues that have come up in my medical training, and I've been really well served by those classes.
Yeah, I think that's a really interesting component too. I think that could be something that could be adopted possibly by the medical education system as a whole, by adding in like a healthcare ethics kind of like curriculum adjustment. I think that would be really cool to see. Do you have any thoughts about that?
Yeah, so I think that's a great suggestion. It's certainly something that would be helpful for anyone going into a career in medicine to be better equipped to think about ethical issues that come up, both on an individual patient level. For example, as a pediatric anesthesiologist in training, there are ethical issues that come up taking care of kids. Like, what do you do if you have an 11 or 12-year-old who doesn't want to have surgery? Do you force them to have surgery? And, what if the answer is yes, you do, then at what age would you not force a patient to have surgery? So, I mean, that's an individual patient level question that come up, but I think there are also
Hmm.
important ethical issues that come up on a systems level about allocation of healthcare resources. And many physicians find themselves in a position to be making decisions about um, allocation of resources, be that on hospital formulary or from a policy standpoint, depending on where you're practicing. So I think it would be great if people were better equipped to deal with these kinds of questions. But the flip side of that is it's really hard to test that kind of information. Um, if you're teaching it to medical students, basically one of the only modalities that you have to test students on that is through a multiple choice test. And so then there's
Hmm.
a question of whether that's an effective way of assessing a training in ethics. But I do think it would be beneficial overall.
Absolutely. Yeah, they'd almost have to kind of go along because of course, there's not always a right answer to a lot of these questions. So it'd almost have to be like a more open discussion based and an assessment more so on like your critical thinking skills and how to kind of build those skills out to deal with the real life situations. So I think that'd be really interesting to see. And I think those are some really good points.
Yeah.
And kind of transitioning real quick into, I guess, anesthesia. So you started medical school, and when did you really come across the profession of anesthesia? And I think the reason I bring this up is I think it can be really difficult to get exposure to this profession while in medical school. It's something that you don't really get to see until later in your classic clerkships. What's your perspective on that, and how did you come to anesthesia?
Yeah, Nate, I agree with you 100%. Anesthesia is a field, it's one of those fields that people very commonly come across late in medical school. And I was no exception to that. So when I started medical school, I was sure that I was going to be an infectious diseases specialist. I had been reading books about Paul Farmer. I read Mountains Beyond Mountains right before I started medical school, which for anyone who hasn't read it, it's a book by Tracy Kidder that I highly recommend. And so I just thought that that's where I was going to go. And when I started medical school was right when Sketchy Micro was starting to come out with their material, I guess it's Sketchy Medical now, but when it started, it
Hmm.
was Sketchy Micro because it was just infectious diseases related material, and I loved it, and I really enjoyed studying infectious diseases. But that's just it, is that I really enjoyed studying it, and I actually took a year to do research in between second and third year of medical school in infectious diseases. But then when third year of medical school started, and I got to look and see what clinical practice was like, I realized that I actually didn't enjoy the clinical practice of infectious diseases at all, really. And the reasons that people go into a field like that, um, spending a lot of time thinking very deeply about a specific problem, and that might be a problem that you spend days or weeks or months addressing. I did not get the kind of satisfaction out of that I had anticipated, and so instead, when I was actually on my OB-GYN rotation, and I was in an operating room, and I had a chance to talk with one of the anesthesia residents. And I had no idea what anesthesiologists did. I didn't think they did very much. And just because we were there talking and I didn't really have anything else to do at that particular moment in time, I got to learn about what anesthesiologists did. And I thought, wow, this actually sounds a lot like what I intellectually like about internal medicine and infectious diseases, but more internal medicine. Um, and it's just the common expression that people say is that the anesthesiologist is like the internist in the operating room, and I think that holds true in a lot of senses, and that really appealed to me. So yeah, I was a third year medical student, and it was a pretty big change to go from 3 years of having thought I was going to go into infectious diseases to really turning things around and exploring whether or not I wanted to do anesthesiology and then make my application reflect that.
Absolutely. I think that's really, really interesting too. And it's kind of funny because I had a very similar experience like that myself, where I started my clerkships just like you did. And I got to anesthesia and I was floored. I was like, wow, this is way better than what I was going to do beforehand. It was kind of one of those like eye opening experiences where I knew instantly. I was like, this is the place I need to be. This is the operating room that I need to be in, but on this side of the curtain. So I think
Yeah.
that's really cool.
One of the
And
things that I'll also add about it is that in conversations that I have with medical students, to any medical student or future medical student who's listening
mhm.
to this, one of the things that I always encourage people to consider is when you have a chance to be in an operating room with an anesthesiologist and there's an appropriate time to sort of get inside of their head and get an understanding for what are they thinking about, why are they making the decisions that they're making, that can be really instructive because if you're just watching an anesthesiologist, it doesn't necessarily look like they're doing very much, and you wouldn't intuit that they're thinking about a lot of things. But as you know, there is so much to think about, so much that we're constantly monitoring, situations that we're planning contingencies for. And so that's really, I think, when you can talk with an anesthesiologist about what their thought processes are, that's when it really starts to open up and become a much more interesting field than it might look like just based on the way it appears in a show like Grey's Anatomy, where they're just sitting there pushing a syringe and pressing a button here and there.
Yeah, I agree entirely. And I think sometimes it can be almost intimidating too to approach some because you're looking at this giant machine with all these numbers flying around and all these medications are scattered out on the table. And don't be afraid to go and ask those questions. Obviously, not in an emergent situation, but certainly I think that's like just being approachable and kind of being curious, I think will go a long way, like you're saying. And to build on that too, do you have any recommendations for medical students who want to get more involved with this profession who might not be at that stage in the clerkships?
Yeah, so I have a few recommendations for medical students. I think the most important thing, the two most important things, so they're equally important. One is you must do as well as you possibly can throughout medical school. And I think one of the aspects of residency that really surprised me is the extent to which knowledge from many different disciplines actually turned out to be really important for anesthesiology. That was something that I had a sense of when I was a fourth year medical student, because because people had told me that. But
Hmm.
then going through 4 years of residency made me truly understand that things like dermatology, psychiatry, pathology, fields that I didn't initially imagine being really related at all to anesthesiology, do have at least some areas of overlap. So it's really important as a medical student to try and just establish the best foundational understanding of medicine that you can, and especially including cardiac and pulmonary physiology, pharmacology, and other major organ systems. So that I think is extremely important. The other thing that I think is just as important is making sure to get as many opportunities as you can to spend time with an anesthesiologist and understand what it is they do, get a sense for how the day goes, what are the things that are rewarding, what are the things that are stressful, um, how happy are they in their career.
Hmm.
I think happiness is a really good surrogate marker of a number of different factors like stress and hours and support and compensation and all of the things that go into a career. So I think it's really important to spend time exploring that as a medical student and make sure that that feels like a good fit before you apply. So those would be my two biggest pieces of advice.
Yeah, I think that's great advice right there too. And you spoke a little bit about residency right there. And so let's transition to talking about more about like your anesthesia experience as a whole. And kind of on a superficial level right now, I think a lot of healthcare professionals really don't understand what anesthesiologists do in the first place. I think there's like a veil or curtain, no pun intended, where they understand, like they don't really understand how we function and what we do. And so, obviously I think few can appreciate how complex things really are when we're planning out cases or acting in like an acute manner. So, with that in mind, can you give us a better idea of what the profession of anesthesiology is really all about?
If I had to put it into one sentence, I would say that anesthesiology is about keeping patients safe before, during, and after surgery. And the second closely related priority of keeping patients comfortable. that would be the one liner that I would have about it. But as you pointed out, there's a lot of mystery around anesthesiology, and there is so much that goes into it, which is why it requires a 4-year residency in the United States, and why there are subspecialties that take additional time for people to pursue additional training. And that was a question that I wanted to spend time trying to answer in a public way, which is, I think we'll have some opportunities to talk about the videos that I put on YouTube. But basically, I make YouTube videos to try to answer that question. And at this point, after a few years of having done it, I've made a lot of videos, and I still don't feel like I have really communicated in full what it is that anesthesiologists do, because it's really the the detail of what goes into keeping patients safe and comfortable in the perioperative period is a lot. There's just a lot that's built into that.
Exactly. I think that's amazing right there. And I think you really summed it up perfectly in the sense that like you said, it is all of these other factors that you have to weigh, and you might have a routine case in front of you, but you have to be ready to act on a million different scenarios if something were to happen or the variables were to change. So you're like doing an equation in your head immediately, and it's kind of building out that reaction time and knowing how to act under pressure too. I think that's really cool. And having just gotten off the anesthesia interview trail myself, I think I'm kind of callous to the question of, what do you love about anesthesia? And my answers for me personally would kind of vary from like the divine alignment of my pharmacy expertise with the procedural care, or enjoying basically like a large variety of clinical cases. So my question for you is, what is your favorite part about practicing anesthesia?
So I'm going to be a little cheap, and I'm going to answer that also in two parts. But I don't think that I would be able to do anesthesia if it weren't for either of these. So one part is the patient interaction, and there is I think there's a lot of misunderstanding, and going back to what you brought up about the nature of interactions that anesthesiologists have with their patients. It is true that in a lot of cases, the interaction that we have is quite short in terms of time duration, um, but it is more often than not an incredibly important interaction, particularly for the patient. And it tends to be at a time period where the patient is experiencing a lot of anxiety related to the surgery or the anesthesia or the illness itself that they're having surgery for. So we have a really unique opportunity to come in and in a short period of time, establish rapport with the patient, try to communicate with them about whatever concerns they may have, and try and help them in any way that we can to navigate I think some of the anxieties that come along with that. So, non-pharmacologic methods, simple things like, when appropriate, putting your hand on a patient's shoulder, or if you're working with a younger patient, pulling out your phone and putting on a YouTube video, or turning on some music can really go a long way to help alleviate someone's anxiety. And of course, we have pharmacologic methods, which tend to be, very effective as well. Although people can have paradoxical reactions to midazolam, so that, it's not always 100%. But certainly, the patient interaction is one of my favorite aspects about anesthesiology, because it's just, even though it's not something that we're doing for necessarily a very large percentage of the day, it's something that when we are engaged in patient interaction, it tends to just be deeply important for the patient, and so therefore is meaningful for me. And then the other part of it is the medicine of it. I love the pace at which anesthesiology occurs, which is sort of this simultaneously slow pace and also very fast pace. As you can be sitting in a case and nothing may change over the course of an hour. That doesn't mean that you're sitting there not doing anything for an hour. You need to actively be paying attention to the vital signs and the patient's positioning. And is there anything that may be causing the patient's harm? Is there a bear hugger that became disconnected and potentially could burn the patient? And no one would know except if you're checking it during that extended stretch where nothing is going on. So you can have protracted periods of seeming nothingness. But then at the same time, in the blink of an eye, you can have a change in vital sign that could be indicative of a myocardial infarction, or any manner of impending disaster in the operating room. And it's on you to think very quickly and act very quickly, in order to help the patient stay safe. And so everything that's wrapped up in that, the pharmacology, you mentioned the monitors, and I love the anesthesia workstation with, multiple displays. And then, if you're in a cardiac case and you've got regional oximetry and you've got a processed EEG, and, the more monitors that you have, it feels like being in a rocket ship sometimes. And I think that it's just, it's a wonderful place to be. So everything that's built into just being in the operating room is, I guess, is kind of a cop-out answer, but I don't know. I love it. I love, just being there and having all of that environment and the thinking that goes on with it.
Absolutely. It sounds like it certainly fits you very well in the sense that you have this opportunity to connect with patients in a genuine way at the point where they're most vulnerable, right before like a scary surgery or even a routine surgery. I think that's can be a very overwhelming experience for a lot of patients. Even myself, if I was to have surgery, I think I would be very nervous too. So kind of
Yeah.
connecting with them, I think is kind of one of the most rewarding things with the profession. And you don't just get to do that once a day. You're doing that several times a day with multiple different patients, depending on your caseload. And I don't think any other profession really gives you that opportunity like anesthesia does. So I love it. And kind of building that out a little bit further, and going back to more so your resident and early fellow experience, what does like the day to day look like for someone who might not be too familiar with the OR?
Yeah, so there can be a lot of variation, but I would say very broadly, if you are a resident or a fellow, depending on what you're doing, you might expect to come in pretty early in the morning, depending on whether there's a lecture and what time your cases are starting. You might be at the hospital at 6 o'clock in the morning, 6:30 in the morning, maybe a little bit later. But I think, yeah, that's probably for a lot of people when you're going to be in the hospital.
Hmm.
You'll on a given day where you're not on call, you may leave at 4 o'clock in the afternoon. You may leave at 6 o'clock in the evening. It really varies depending on what hospital system you're in, what the staffing model is like. And then in addition to that, so, call means different things to different people and is typically defined by the program within which you're working. So there are a lot of different types of calls. For example, where I did residency at Mount Sinai Hospital. So some are late calls where you stay until relatively late in the evening, and then there are overnight calls that entail being in the hospital until 7 or 8 o'clock the next morning.
Hmm.
So, very broadly speaking, I would say that most residents could expect to be on call, on an overnight call, probably 3 or 4 times a month, maybe a little bit more frequently depending on what program they're going to.
Hmm.
There can be a fair amount of overnight call that's involved with training, which is something that can be taxing. Um, However, I'll say many anesthesia programs, at least for residency, and depending on where you go practice, will allow you to have a post call day. So once you're done at 7 or 8 in the morning, then you're off for the rest of the day. And in a lot of places, the calls themselves are moving away from 24 hours. They're not all there, but a lot of places will have overnight calls that start at 3 or 4 o'clock in the afternoon. So you're not on for a full 24 hours. So that means that you get, the day free until 3 or 4 o'clock. You're on call until 7 or 8 the next morning, and then you have the next day off. And I would say, as far as weekends are concerned, again, just speaking in generalities, you might expect at any given program to be working, maybe 2 weekends a month,
Hmm.
maybe one. It depends, but it is important to keep in mind that most hospitals are going to have an anesthesiologist, or depending on the hospital, multiple anesthesiologists in house, in the event of an emergency surgery that can come up. So depending on where you go practice, you may be responsible for staffing nights and weekends, but there are also anesthesia practices where you're just doing elective surgery, and there's no expectation of staying overnight or on the weekend. So there's all manner of practice out there for attending anesthesiologists, but certainly during residency and for a lot of fellowships, there will be weekend and overnight call.
Interesting. And I guess building on that too, because you talked a little bit right there at the end about an attending work-life balance and whatnot. So, and kind of to provide context, I think one of the some of the best advice that I received while going through my clerkships was to learn about what both a resident does, but also what the attending does, and kind of how their work responsibilities differ. I don't think too many students often get exposed to one or the other, or they kind of have like a preference leaning one way. And I think it's important to understand the different challenges that they face with the workload. So I know you're not quite an attending yet. You could theoretically be without a fellowship, but how does that attending life balance like kind of compare to residence?
So that is a great question, and it's one that has a lot of different answers depending on what type of practice someone decides to go into. So I'll paint sort of a picture of two ends of the spectrum. So on the one hand, you could go work someplace, as I was just alluding to, where there's no expectation for overnight call and there's no expectation for weekend call. Um, there are jobs that are out there where you come in at 7:30 in the morning, and cases are generally done by 3:30, 4 o'clock in the afternoon, and that's Monday through Friday, and that's your work week. On the other end of the spectrum, there are practices where you can frequently take overnight call, you frequently take weekend call. You may be working. I mean, if you want to go work 80 or 90 hours a week as an anesthesiologist, you certainly can do that. And then there is every type of practice that's in between those two points on the spectrum. And it really is just a matter of what is available, of course. And at the present time that we're recording this, there's a huge need for anesthesiologists in the United States. And so things are cooling off a little bit in terms of the job market, but I think broadly speaking, it's pretty easy to get a job doing whatever, if you want to work a lot, if you want to work a little, and sort of regardless of the location where you want to work, you can do that. So obviously there needs to be a job that's available. But then the other question that comes up is, what kind of practice do you want to be in? Would you like to be in an academic setting where there's research going on, where there is knowledge that's being developed, where you're going to be working with trainees? Or would you prefer to work in a private setting that's the opposite of that? And so I don't think there's a clear right answer. I think there are pros and cons that come along with every type of practice. But if you go work in private practice, you don't have trainees. So if you don't enjoy teaching, that's a great option. And in private practice, there's not going to be the generation of knowledge per se. Generally speaking, there's not necessarily research that's going to be going on. So if that's important to you, then private practice isn't a great option. So it really just depends on what kind of practice you're interested in having and whether you'd like to be involved with more academic types of activities or not.
So it sounds like it could really be individualized to the current needs and where you're at with like your life experience and where you want to take your professional career.
Yeah,
And
exactly. The other thing that's I think important to talk about, and people can be hesitant to talk about this, is compensation. So depending on what your personal circumstances are and what your priorities are, that may also drive you towards one route or another. Where generally speaking, people are compensated more in private practice. That's not always the case, but as a general rule, I do think that it is important for people to have conversations about compensation because it's one of many aspects of a job that are important to discuss. So that can be a guiding factor as well.
it's interesting too, speaking on kind of like reforming like the medical education system, adding ethics into the curriculum. But it would be really interesting to see if they explored like contract management courses or like an elective you can take where you kind of talk about some of these important financial decisions. And I think that would really go a long way with a lot of students who don't have any kind of experience with that. And I think that'd be really interesting too.
I completely agree. And to that end, I will just say that as part of my residency training, they actually, so Mount Sinai brought on a contract attorney who specializes in anesthesiology contracts to give us just a broad overview of what it is that we should be looking for, what are the pitfalls. And it was such an informative conversation. And so then when I started negotiating my first job, which I have signed my contract for, I went back and I went to the same contract lawyer and I hired him to look over my contract because I think it's just really important to have that be part of what we're thinking about when we're looking at a job. So I would recommend that people at least consider looking for YouTube videos or podcasts or what have you about contracts before you start looking for a job or as you start looking for a job, because as you pointed out, these are things that don't necessarily get taught as part of the curriculum, but are vitally important.
That's really cool that they were able to do that for you too. And I think you're right. A lot of this stuff can kind of slip through the cracks because, of course, medical school's primary goal is to make you a good clinician. But there's a lot of other things that go into that too. When I think, as doctors, can be most focused on our patients when there's not a lot of behind the scenes stuff that's kind of interfering with our attention. So I think that's really cool that they were able to do that for you. And I'm curious to know, speaking on like kind of contracts and moving on to the next stage of your training, why did you pick pediatric anesthesia and how has this advanced training impacted your personal practice in the OR?
So I actually had no intention of doing pediatric anesthesia. In fact, I intended to steer very clear of it. I remember having a conversation when I was a CA1. So for the uninitiated, CA1 stands for Categorical Anesthesia Year 1, which is the second year of postgraduate training. So PGY to CA1. It's very confusing, and I think an unnecessary vestige of the past. But anyways, suffice it to say, early on in training, I was talking with an attending who's a pediatric anesthesiologist, and we had some time to kill before a case was getting started. And I was just kind of curious and making some small talk, and I said, "Why did you do pediatric anesthesia?" And I said, as I was asking this question, I was like, "I'm definitely not going to do peds, so I'm just curious why you did." And so this is not original for me to be citing what he said, but what he said rung true, which was my inspiration for pursuing a career in pediatric anesthesia, which was the following, which is very generally speaking, in a pediatric operating room, it tends to be the case that everyone who's in the room, so the physicians, the nurses, the techs, everyone is very patient focused and very patient centric in a way that is not always necessarily the case in adult operating rooms. And I have found that to be true throughout my training. And I can't explain why that is. I don't have any data to back this up, but I really felt a difference. I feel a difference when I'm in a pediatric operating room. If I, as the anesthesiologist, bring up a concern about something patient related, it's taken seriously, as it should be anywhere. But unfortunately, that's not always the case. In certain ORs, if a tech brings up an issue that's patient related, everyone takes it seriously. It just feels like there's generally less of a hierarchy, and there shouldn't be a hierarchy in an operating room. I mean, everyone is really working on the same team to take care of the patient, and I think that generally is best reflected in a pediatric OR. And I really love that. I like going to work and thinking that everyone who I'm working with is working towards the same goal and not having anything that makes me question that. And so I have found that to be true. Another point that this attending brought up is that if you can get really skilled at doing any of the procedures that are related to pediatric anesthesiology, you will necessarily be better at that skill when it comes to doing it to an adult. So if you think about cannulating the radial artery of a 1-day-old, if you can do that, then you can cannulate anybody's radial artery. And I have also found that to be true. Same thing applies, to peripheral nerve blocks, neuraxial anesthesia, airway management. We take care of patients who have extremely small airways because they're really small patients. And so that's another reason that I initially found pediatric anesthesiology to be um, interesting. And as I have gone through my fellowship training, I find that to be a continued source of professional challenge. And I think that even just looking at my attendings, they know that IVs, no matter how many years they've been in practice and how many IVs they've placed, they know that a patient can bring in vasculature that's very humbling. And I've had attendings with many years of experience, um, try to place an IV in a patient, and after several attempts, they call in for someone else, and it really helps keep people humble. And I feel like that happens maybe a little bit more in pediatrics than in adult anesthesia. Um, and then, the other thing that I have really been drawn to in pediatric anesthesia is that by virtue of the patient's physiology and sort of the details that aren't necessarily worth going into right now, but suffice it to say that the pediatric patients just when things go wrong, they tend to go wrong quicker and necessitate a faster diagnostic workup and a faster response. And I just really, I think people either fall into the category of really enjoying that challenge or really wanting to stay away from patients who could crump really quickly. Um, and so pediatric anesthesiologists, I think, are a pretty self-selecting group in that way. And same thing for cardiac anesthesiologists. There's something about working with patients who are higher risk that I find appealing, and so that's the other big part of the draw for me. And also, the last thing that I'll say is that it's really fun to work with kids. I mean, you can be as goofy as you want. You obviously have to read the room,
Hmm.
but you watch Glockenflecken videos, and he shows up with a unicorn headband. Like, if I wanted to do that, I could do that, and nobody would question me. And like, how fun is that? To work in a place where you can just be as creative and funny as the situation allows. Um, but you can't do that in an adult operating room. You would get thrown out. And so it can just be really fun uh, to work with kids, and you don't get that in other places in anesthesia.
Yeah, I think you brought up some really interesting points there too, and some things that I've never really thought about myself. With regards to, like you mentioned, like the heightened focus, where everyone is kind of more on their toes about kind of the approach to things, or if there's like you were saying, patients can decompensate quickly, and that was something I never really thought about before. And I guess from like my pharmacy perspective, I think about like volume of distribution and how medications kind of change with patients. So it's just kind of like opens Pandora's box when it comes to all the possibilities. And I think there tends to be like a lot less data when it comes to utilizing medications in the pediatric population. So you're almost more so working on like the frontier of kind of clinical practice. So I think that's really interesting and cool.
Yeah, absolutely. I'm actually on an ICU rotation right now, and there's a pediatric critical care pharmacist who rounds with us, and the information that they just like exude information about pharmacology that is really fascinating, and I think oftentimes very unique to pediatric patients. So that's a whole other um, area of fascination is the pharmacology that comes along with taking care of pediatric patients.
Absolutely. It's like this one, very rare case that you're working with and the pharmacist comes over. It's like we have some esoteric, papers that were filed back, 10 years ago and on this one particular case study. And it's kind of funny how they like pull this information out of nowhere. You're like, wow, where'd you find that? It's not even on the
Yeah,
internet. Uh,
exactly.
awesome. Awesome. And so just to kind of finish up with the anesthesia content right now, you mentioned a bunch of other fellowship options. So I just want to explore what other opportunities could residents who are thinking about doing fellowships explore.
So there are a number of different fellowships in anesthesiology. I would say that the more common ones is probably the best word to describe them. So obviously, there's pediatric anesthesiology, cardiac anesthesiology, which I mentioned, and all of these fellowships are 1 year long fellowships. So cardiothoracic anesthesia is for taking care of patients who are undergoing cardiac surgery or thoracic surgery.
Hmm.
And then ICU medicine is a 1-year fellowship out of anesthesiology. And people will notice that for graduates of internal medicine who are going into pulmonary critical care medicine, that is a longer fellowship, but that actually entails 2 board certifications. That's a board certification in critical care medicine and also pulmonology. But coming out of anesthesia, you get board certified. You can do a 1-year fellowship and get board certified in critical care medicine. Pain management is another subspecialty of anesthesiology. It, in a lot of ways, is very different from anesthesiology. Pain management is almost exclusively outpatient. There are some exceptions to that, but it's a very different practice of medicine compared to general anesthesiology or any of its subspecialties. And then the other 2 sort of more popular subspecialties are regional anesthesia, which focuses on nerve blocks and pain management in the perioperative period. And then obstetric anesthesiology, which as the name implies is for obstetrics. So those are the more popular ones. There are several other subspecialties that are out there that maybe are a little bit less popular, but I think are interesting nonetheless. So neuroanesthesia, so providing anesthesia for neurosurgery. Liver transplant anesthesiology, because liver transplant anesthesia, I had no idea before I started, you know, residency really, but liver transplants can be just beasts unto themselves. And so that can be a subspecialty for a year that people spend extra time pursuing. And also head and neck anesthesia. So this is focusing on patients who have pathologies like airway tumors or any sort of issue that is potentially going to introduce respiratory compromise. And there are other subspecialties that are out there, but those are the main ones that come to mind for me.
Awesome. Yeah. So it sounds like on top of just like the kind of various opportunities a resident can have after graduating and working in different like clinical settings, but they also have tons of different opportunities with regards to just like the patient population that they want to work with in particular. And so like, for instance, you mentioned pain. And I think it's really interesting because not a lot of people realize that you can also work in the OR 2 days of the week, depending on what kind of contract you set up, and then go work in a clinic for the rest of your week. And it's just, it kind of changes up the whole dynamic and how you want to kind of structure your life around it. So I think it's really cool that there are so many options with anesthesia.
Yeah, exactly. And you bring up a great point to sort of highlight how many different ways you can practice anesthesiology. I think the hybrid model you just mentioned is a great example.
For sure. And now, outside of your professional activities, you've also created this massive YouTube channel that I think has done a great justice to medical students around the world. What initially prompted you to create this channel in the first place?
Well, first of all, I appreciate that. I You and I were talking earlier about how little exposure or how little exposure medical students get to the field of anesthesiology in a lot of places. And so that was my inspiration because as we were talking about, I didn't learn really anything about anesthesiology until I was a third year medical student. And I wished that I had learned about it earlier. I
Hmm.
may have pursued different research opportunities or what have you. And so I wanted to make videos to show other medical students. Well, at the time I was doing it as a resident, so I wanted to show medical students what anesthesiology was all about. And so that was really the inspiration. But the other target audience that I had was also my parents, and still continues to be my parents, because when I applied for residency in anesthesiology, my parents are very supportive and very bright people, but they didn't really know what anesthesiologists did beyond, whatever encounters they had or heard about with anesthesiologists, which, from the patient's perspective, can be pretty limited. You meet
Hmm.
someone for 5 or 10 minutes, and then that's the last that you think of them because you don't remember anything else. So I really wanted to show my parents what it is that I do. So I like to bring that into my videos as well, knowing that they're part of my audience.
I think that's so cool too. And as someone who is in the medical field with not a lot of, I don't have any other family members that are involved in the medical profession. So I think it's really cool that you're able to do that for your parents. And it's kind of like motivation for myself too.
Yeah, I will say also, on occasion, someone will comment to me, a co-resident, a co-fellow, and say, I showed my parents some of your videos, and now they have a little bit better of a sense, or at least they can see what it is that I do. So thanks. And I love getting that comment because it just resonates really strongly with me.
Absolutely. And kind of speaking on the impact that you've had when you first started this, did you ever anticipate that your channel would grow as big as it has?
Definitely not. um, no, and what's really funny is I of course follow a number of other YouTubers who are physicians, or physicians in training, and one of them at the time, Mike Cellini, was a fellow where I was in training, and I remember meeting him. As my channel had like a couple hundred viewers, and I remember meeting Mike. I had an assignment to work in the same OR as him, and I just remember being so starstruck. I was like, this guy has like 200,000 followers, and I just never ever thought that there would be that many people interested in learning about what anesthesiologists did, basically.
Absolutely. And, as a fellow and I guess emphasis on new content creator myself, I can appreciate the struggles of trying to build up a brand and online presence, like you mentioned. And I'm finding it's very time consuming to do this. And I don't think a lot of people appreciate the behind the scenes stuff that goes into it. And it's very time consuming in the sense like I'm a fourth year medical student, and it certainly has a reputation of being a very easy year. And I'm still struggling to find time to make it happen. So I'm curious to understand how you found the time to work on your channel throughout your residency training.
I 100% agree with you with that assessment of the time investment involved. And my answer is multifaceted. So one is, um, I think that it's important to try and be as efficient as possible, in basically every aspect of content creation. So to that end, I invested 5 hours of my time watching tutorials on Final Cut Pro to learn how to use all the shortcuts and try and just get through it as fast as possible so I can edit my videos as fast as possible. Um, I also experimented with hiring someone else to edit my videos, and I found that to be slower because I had to explain technical terminology, and then I would, there would be a back and forth, reviewing a draft and another draft, and that ultimately took more time than me just editing the videos on my own. Um, and efficiencies in recording, I think, are really important. I have a really basic setup that includes a light and a stand for my phone and a microphone, and that's it. And trying to just keep things really simple so that I can go into an operating room, record things quickly without too much setup and breakdown. That just makes things go a lot faster. So lowering any sort of barriers you have in terms of time, I think, is important. um, I think that it's also really important to make sure that you're actually enjoying it, because if you feel like there's too much production pressure, which sounds like a silly thing to say, but once you start putting things on YouTube, or really, I suppose, any of the social media platforms, the reason that social media one of the reasons that social media is so prevalent these days is because every platform has a way of sort of inducing production pressure through one mechanism or another. And it's very easy as a content creator to just get caught up in that and think that, oh, if I make more videos, then YouTube is going to promote my videos more. And I think that is actually true. So for people who post more videos, YouTube tends to shine more of a light on them. But at the end of the day, my career is anesthesiology, and I do the YouTube stuff for fun, and
Hmm.
so it needs to stay a fun thing. So the moment at which it starts feeling like a job, like there's production pressure, I just tap the brakes, and I'll go a month without posting anything. I don't care. Like I need to make sure that I'm enjoying it. So I think that that's really important as well. Um, the other thing that has been extremely helpful was when I was a resident at Mount Sinai, the department and the hospital were extraordinarily supportive of my YouTube channel. So if you're going to be doing any kind of social media around your job as a physician, um, you need to follow all of the right steps in terms of privacy and permissions and making sure that everything that you're doing is above board. But in addition to being supportive with all of that, Mount Sinai and the anesthesia department in particular, they literally gave me time while I was in residency to record YouTube videos. I not my idea. It was my program director's idea. It was Adam Levine's idea. He said, "Do you want to take non-clinical time so that you can record YouTube videos?" And I was like, "Yeah, I would love to do that." And I did. I spent a ton of time. I arguably spent more time doing that in a given week than I spent doing clinical work because I, had this opportunity to just sort of um, have at it with recording whatever I wanted to record. So I got a lot of help from the residency program as well. That came later on. That was after I'd been doing it for a couple or 3 years at that point. But yeah, those are the things that I think have been really helpful.
Wow. I think there's definitely a lot to unpack there too. And I think it's funny you mentioned like watching all these tutorials online, trying to figure things out, because I'm kind of in a similar position now. And one of the biggest takeaways from medical school is actually downloading those accelerators where you can like click the button and it speeds up your videos.
Yeah.
And so I've been using that and it's been very helpful kind of getting through those kind of tutorials and kind of editing my videos.
If you're not watching something on 2 speed, then like, is it even worth watching at all?
Right, exactly. And also to building on like what you were saying about like the quantity of videos, and I think Mr. Beast said it. And for those of you who aren't familiar, he's like the most famous YouTuber in the world, and he essentially would say he would prefer to make one quality video than a million other subpar videos. And so I think what you do in particular is you focus on building really quality videos, and that's how you've built out this community where there's so many people who trust what you say. And I think that's awesome.
And I have watched an interview with Miss. We probably watched the same interview. I think that is excellent advice.
Alrighty. Well, we're getting to the end of our interview at this point in time, and it's time for our famous 3 questions, which are the same 3 questions we ask every interviewer who comes on the show. How do you maintain a work-life balance in your demanding profession? And what advice do you have for individuals who are trying to obtain the same balance?
So I will be completely honest. There are periods of time in the last, I started medical school 10 years ago at this point, 9.5 years ago. There have been extended periods of time where I had no work-life balance. And I think that it's important to bring that into the conversation for people who are pre-med or in medical school, and I don't think that normalizing that is okay, but at least to have a conversation about the fact that for many people, there is so much work to be done that you just cannot have a work-life balance. Having said that's not always the case. And certainly, residency and fellowship, there have been a lot of built-in mechanisms at work to ensure that I have time off and pre-call days and post-call days off. So those are sort of built in from the system. Things that I have done to maintain a work-life balance, going back to, if I'm not having fun doing something, then I try and scale that back to the extent that I can. Obviously, there's a certain amount of studying that you have to do as a physician. You really shouldn't scale that back. But I try and just take time for myself. So working out, I've gotten into running recently. Reading, watching Breaking Bad again, and things for yourself, I think are extremely important to do. But having said that, depending on where you are in your training, it's not always easy to do that. And so I think that's an important part of the conversation.
Of course. Alrighty. Question number 2. Do you have any last minute recommendations to students or graduates interested in pursuing a career similar to your own?
I think the most important thing that you can do, particularly if you're pre-med, is spend some time with a physician, spend some time with an anesthesiologist, and really try to get inside their head and try and understand, is this person happy with what they're doing? Would I be happy if I were doing what they were doing and everything that, they're describing to me? So I think that's really crucial.
Of course. And our final question, what are your personal, professional, or business oriented goals that you'd like to accomplish in the next 5 to 10 years?
So professional goals, I am actually going to be pursuing a career in pediatric cardiac anesthesiology, and I will be going back to Mount Sinai
Wow.
to work there as a peds cardiac anesthesiologist. And so my goal is to become the most competent anesthesiologist that I can become. And I think that that's going to be a lifelong pursuit, but especially, the first few years after training. I think a lot of people say that tends to be the hardest part of training is really after you're done with your formal training and you start uh, in your careers and attending. As far as business goals, you know, technically my YouTube channel is a business, but it's really only a business because for liability purposes, turned it into a limited liability company. I made an LLC. But the only goal that I have for my YouTube channel, for my business, so to speak, is to just continue enjoying making videos. Because without that, I don't think that it's worth doing. And personal goals, you were talking about work-life balance. I would love to continue having more of a work-life balance. I think I had the hardest time when I was a medical student. It was easier when I was a resident, and fellowship as well. So it's my goal to continue to do that once I reach attendinghood in the not too distant future.
Fantastic. Alrighty, so we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, the profession of anesthesiology, or other non-traditional topics, check out my website at www.physicianpharmacist.com. Before we let you go, where can our listeners get in touch with you or learn more about you?
If you want to get in touch, feel free to write me an email. My email address is just maxfeinstein@gmail.com. And if you'd like to learn more about what it is that I do, you can check out my YouTube channel where I try and explore as many different parts of anesthesiology as I can.
Alrighty, perfect. Well, thank you so much again for being on the podcast today. I know you're extremely busy, so I really do appreciate your time.
My pleasure. Thanks again for having me, Nate.
Alrighty, take care.